Another question was who is running the ventilators. So Lauren kind of spoke to that a little bit, but it's different on every floor. So we're not working in this, we haven't so far worked in the same ICU, but I haven't touched a ventilator other than giving a patient more oxygen when they need it. The physicians on my floor have been doing all the ventilator management, and then respiratory therapists do come by and see the patients. But I'm sure they're in a similar situation as us where there's just not enough. There's, 30 patients on the unit that I'm working on that are all vented or are on ventilators. And a respiratory therapist can't see all of those patients and ones on different units and be able to protect all of these patients in the way that they normally would. So everybody's kind of taking on a new role, and whoever sees a problem is the first person to try and fix it. Yeah.
Mm-hmm. Yeah.
Are you wearing the same PPE all day? So kind of. So this kind of ties into, somebody asked why we were wearing paper scrubs in one of the videos that was on my Instagram. But we're given paper scrubs when we come in, and they're actually the scrubs they use on the psych unit in the hospital. And those are the only extras they have. We're not given OR, real OR scrubs. So we change into those. So that's our first line of protection from our own scrubs and clothing.
Which is nice.
Mm-hmm. Mm-hmm. And then when we get to our unit, this is at least for me, I put on a really thick gown. It's actually the gowns that they use to perform surgeries in the operating room. And then on top of that, I add the regular isolation gown that you would see in the movies, essentially, or see in a hospital for you nurses. So I wear the surgical gown the entire day, except for when I go to lunch, to protect my scrubs so that I'm clean when I go to eat. And then I only change my top gown if I get it dirty, essentially, or if I go to lunch or the bathroom. What about you?
Yeah, that's exactly what I do. And then, when I'm going in and out of patients' rooms, I put on the disposable plastic gown that we're given, just so that I'm not going from patients' room to room with the same gown to protect them. And then I also put on, and I think you do too, a hairnet.
Yes,
when I get there. Mm-hmm. And a lot of times I'll double gown too with or double glove, sorry.
Yep.
Just, it feels better. And I pretty much always wear gloves on the unit unless I have to take my finger out to get into Pyxis. So the Pyxis is the medication dispensing machine.
You use your fingerprint to get your medications.
Yeah.
How high is the acuity of our patients? So that we kind of already answered.
The highest.
The highest. They're the worst, the most sick. Mm-hmm. And we're both ICU nurses, so we see the sickest patients.
And it's crazy because most of these patients, if it wasn't in the middle of a pandemic, we would definitely be 1-to-1 or definitely no greater than 2-to-1. So it's a lot different. Are your coworkers helpful and nice? So that's been one of Chris and I's biggest positives of this whole experience is we are just blown away by how nice people have been for us coming here and being willing to help out and leave our homes. They've just been so grateful, and everyone just really comes together, and it doesn't matter if you're a doctor, a nurse, a CNA, a housekeeper. It's just whatever the job that needs to be done gets done. Mm-hmm. And people support each other and are as positive as they can be for how hard this work is. And it's been truly humbling to see how people really lift each other up. Mm-hmm. It's been good.
Yeah, it's been my biggest surprise for sure. Mm-hmm. For you healthcare workers out there, for example, on the floor that I've been working on, because everybody is so busy, there's a resident doctor who is in charge of drawing all of the labs for the entire floor, and he runs them all to the lab himself, which is insane, because if anybody or any of you that are nurses, you would know that would never happen unless you really were having trouble getting a blood draw from this patient. It's just everybody's taking on new roles, and it's really amazing.
It's pretty
to
cool.
see the teamwork just for, just to help the patient. It's awesome.
Yeah. I think that's kind of what like once we noticed that, we're really glad we came, because it makes it all worth it for sure. And it's cool to be a part of an experience
where the number one priority is the patient. It's just amazing that everybody cares the same amount about that patient. Like she said, the housekeeper, it doesn't matter who it is in the hospital, they'll do whatever they have to do to help. Are people out and about, or is it a ghost town? So the area that our hospital is in, I feel like is still super busy. There's still traffic. I'm sure that it's not normal New York City traffic. I'm sure it's not the same amount of people that are normally out. So it's kind of hard to gauge what it would be like. But it is, like I said, the area we're in is a lot of homeless and a lot of poverty. So I think that a lot of the people that we're seeing out don't have anywhere else to go.
Yeah, and that's pretty much the only place we're going to is just work, and then we stay in our hotel room on our one day off we've had so far.
Yeah.
So
and there's not very many people at our hotel. We're we're 10 miles away from work, which is actually kind of nice because there's not as many people staying here. They're actually closed to the public, so everybody that's staying here, they are healthcare workers. And we just actually talked to the front desk a little while ago, and they said that they only have 33 of their 150 rooms filled right now, and any other ones in the future will go to healthcare.
And our company too, I know a lot of people are asking where we're staying. They recommended this place to us, and they got us a discounted rate, so it all worked out. And are there shortages of ventilators, meds, and PPE? So we kind of talked about the ventilators. I do know that the ventilators are being moved on a day-to-day basis. So because we're the epicenter of the COVID-19, that we have the first priority for vents. So we're obviously trying to not have to use it if we don't have to. Any patient that comes in, we're trying to do everything we can to avoid it, not to not save them, but to save vents for people who need it.
Where it's more dire, to hold off as long as they can before they have to intubate somebody. But the doctor that I spoke to at work told me that they're literally moving these ventilators from hospital to hospital every single day, and moving them from upstate New York and bringing them to us if we need it. So I'm not sure how many extra ventilators we have to use at the hospital when people come in, but when it does run low enough, they will try and get them from other areas. In general, there is a huge shortage of ventilators because, for example, this hospital, this same doctor told me this, that it's a smaller hospital, but they only have maybe 20 vents total that they keep in the hospital, and 10 is usually what they're using, and the other ones are just extras in case every single ICU bed would have been full. And right now we have over 150 ventilators in the hospital, and we're opening new units every other day. So, and these are all ICU units. They're not people like you and I. They're people that are really sick and need it. So thank you for watching, and we'll see you in a couple days.
Yeah. Stay safe, guys. Wash your hands.